Welcome to Impacts on the Global Black Lifespan Journey, an Afro-Mosaic health guide explainer. Today, we're digging into something we're calling the stolen years. We're going to look at how diabetes and kidney disease are being shaped by, of all things, food labels, and what that really means for life expectancy in the Caribbean.
So let's just jump right in with one single powerful number, 75%. According to the data, that's the percentage of all deaths in the Caribbean that are caused by non-communicable diseases, things like diabetes and heart disease. And this isn't just a statistic. It's the foundation of a systemic crisis that is actively reshaping how long people live across the entire region.
Now, what's really crucial to understand here is that this situation is a kind of global forecast. You can think of the Caribbean as a canary in the coal mine. It's an early warning. What's happening here gives us concrete evidence of how health outcomes get shaped when chronic disease just becomes normal, especially in majority Black nations. So this isn't just a regional story, not at all. It's a preview for the rest of the world. So here's how we're going to break this all down. First, we'll start with why this is such a major global health warning. Then we're going to trace the roots all the way back to the plantation economy's long shadow. From there, we'll connect the dots to modern trade, policy, and diet. Then we'll look at the system of late care that results, and finally, we'll see how all of these pieces come together and compound across a person's entire life.
Okay, let's start with that big picture, a global health warning. The most important thing to get here is that this crisis in the Caribbean isn't evidence of individual failure or, people making poor choices. It's actually a really clear demonstration of what happens when entire systems get strained right to their breaking point. This right here. This is the core idea we're going to be exploring today. Health outcomes are being decided by huge, large-scale structures, the food that's available, the information or lack of it on labels, and a healthcare system that was shaped by a history that values economic output way more than it values wellness. So let's unpack how that actually works. To really understand what's happening now, we have to look to the past. In this section, the plantation's long shadow, we're going to see how a historical blueprint, a design from centuries ago, is still influencing health systems and outcomes today. A key concept from this history is something called the plantation sick house. Now, this wasn't a system of care in the way we think of it. It was really a management tool. Medical help was only given at the point of failure, when an enslaved person's ability to work was at risk. The logic was crystal clear. Health was just a cost you had to manage to keep the labor going. And this slide, it draws a direct line. On the left, you've got that old plantation logic. Sickness was all about lost time. And on the right, the modern version. Today, this health crisis is often framed in economic terms, as GDP loss to reduced workforce participation. The language has changed, for sure, but that underlying logic, it's disturbingly familiar. So let's look at how this historical way of thinking plays out right now. This section gets into trade, policy, and diet, the modern systems that are creating the perfect conditions for chronic disease to thrive. Ever since the 1990s, there's been this big shift called the nutrition transition. Basically, trade liberalization policies opened the floodgates to cheap, ultra-processed foods from other countries. The result? Many Caribbean nations now import over 80% of their food. And this has systematically pushed out traditional, often much healthier, local diets in favor of these affordable, high-energy but nutrient-poor options. And the consequences of this shift are, well, they're stark. Just take a look at these numbers for adult overweight and obesity rates. In the Bahamas, it's almost 70%. In places like Barbados and Trinidad and Tobago, it's over 60%. These aren't just random numbers. They're the direct outcome of a massive, systemic change in the food environment. In response to this, public health advocates have been fighting for a solution that's actually pretty simple and evidence-based: clear warning labels on the front of food packages. Something that helps people quickly see if a food is high in sugar, salt, or fat. But this policy fight has been dragging on now for 5 years. And this timeline really tells the story of that struggle. The process kicked off in 2018, a key vote failed in 2021, and the whole time, the food and beverage industry has been actively working to delay and water down the policy, even paying for its own studies to create confusion. The result is that the simple, scientifically backed public health tool, the black octagonal warning label, is still stuck in limbo, caught between public health and corporate profits. So all of this brings us to the healthcare system itself, which we're calling a system of late care. Because of all these other pressures we've talked about, healthcare in the region is often forced to start at the point of failure, not the point of prevention. Here's the key idea: when high rates of diabetes and hypertension just become the norm, health systems have no choice but to shift their resources away from prevention and towards containment. The main focus becomes managing severe late-stage problems, simply because the number of cases is completely overwhelming. And if you think about it, this looks a lot like that historical sick house model we talked about earlier. The system is heavily focused on really expensive, late-stage treatments, like dialysis for kidney failure. At the same time, things like early screening and primary care are often underfunded and inconsistent. This means people often only get into the system after the damage is already irreversible, which really reflects a system designed to repair people, not invest in their long-term wellness. Okay, so now let's see how all these pieces fit together to affect a single person's life. This is where we see the risk compounding across the lifespan, as all these systemic problems pile up from childhood all the way through adulthood. Let's just walk through the steps of this journey. It all starts with early exposure. As we saw, childhood obesity has doubled because of diets full of imported, processed foods. After decades of this, it leads to high rates of diabetes and hypertension in midlife. And because of that system of late care, many people will only get consistent medical help when an organ starts to fail, like needing dialysis for their kidneys. The tragic result is premature death, with lives cut short by complications that were fundamentally preventable. This quote just perfectly captures the systemic heart of the problem. Caribbean people are part of health systems all over the world through migration, but the same outcomes, higher rates of diabetes, faster progression to kidney disease, they often follow them. The geography changes, but the outcomes don't, unless the systems themselves actually change. And that's exactly why we have to be so clear about this. The Caribbean isn't behind the curve, it is the forecast. The region is basically giving the world a blueprint of what happens when prevention isn't a priority, and when majority Black populations are the first to feel the effects of inefficient health and food systems. This leaves us with a really critical question. The evidence is showing that if our systems don't change course, this crisis is going to go global. So the warning bell has been rung. The real question is, what are we going to do about it? To keep exploring these kinds of critical issues, make sure you follow our Impacts on the Global Black Lifespan Journey series every week. For more evidence-based analysis, you can always visit us at amhg.ca. And of course, please subscribe and follow Afro Mosaic Health Guide magazine on YouTube, Facebook, X, and Instagram. Basalero!